over-the-counter medications. So the 3 learning objectives are to discuss treatment options of commonly used medications that are available over the counter without a prescription, talk about different options we have as it applies to older adults, and look at the safety profile of these medications as it pertains to older patients. So, okay. So the definition of the over-the-counter medication is, the FDA definition is that drugs that are safe and effective for use by the general public without seeking treatment by a healthcare professional. And really the key word here is safety, not necessarily efficacy, because there are a few items out there that are questionably effective, but they're very safe. There's, for example, a product for nausea, which is usually advertised to pregnant women, so not related to Jerry. But if you look at the active ingredients, it's basically a bunch of sugar water, packaged in a small couple of ounce container, which costs about $12. You can just as easily buy a 7-Up can, get rid of the bubbles and drink it. It'll have the same effect. So safety is really the key when it comes to over-the-counter definition, not necessarily efficacy. Okay, so there are 2 ways of getting a product to the over-the-counter status, and it's really every pharmaceutical company's dream to have something marketed over the counter, because exposure to that medication expands exponentially, and so all of a sudden how often it's purchased goes up exponentially. So everybody wants something over the counter, but there are 2 different pathways. One is to approve brand new medications straight to over-the-counter use. That's generally not done routinely, because usually you want safety to be examined first. So most of the time, something is going to go on the prescription side. So it's going to be a prescription product. And over the years, it's, people decide that it's safe enough to go over the counter. So then they switch to the over the counter status. And there's certain labeling requirements that are pretty uniform over the counter that I'll go over in the next slide, certain marketing conditions, and they have a very limited number of acceptable active ingredients that can go over the counter. So with that limited number of ingredients, you have aisles and aisles of products at an average pharmacy. And the reason there's so many products out there is because they're just endless combinations of various active ingredients that are approved for over-the-counter status. And that sort of leads to a lot of confusion patients and sometimes providers have when choosing an appropriate over-the-counter item. So these are the labeling requirements. They all have to have an active ingredient section. So this particular product is chlorpheniramine, which is a first-generation antihistamine. It has to have a uses section that's easily understood by the lay public. Warning section, what to do in case of overdose, basic directions, and inactive ingredients. So this can be useful, if there's an allergy to a particular dye or something that the patient might need to look at, and also storage information. I have to tell you, every time I look at an over-the-counter product, I have to flip the packaging several times before I get to this section. Sometimes it's awfully small, and for some of our older adults, pretty difficult to read, but you do want to advise them to look at the active ingredient section, because a lot of times in the over-the-counter market, it's going to be a combination of things. Here are the requirements for labeling for a supplement or a vitamin. There's a little bit of a difference in this area. These supplements are not considered drugs. They're governed by a different part of the FDA. They look at these products as food items. So the requirements aren't the same. So this is a typical supplement with a bunch of vitamins in it. What's important here is percentage daily value. So this particular product has 100% of recommended daily allowance. So this would appear to be a pretty good vitamin product, because it's got a bunch of different vitamins with 100% of recommended daily allowance. A lot of the products out there have 1,000%, 500% of the recommended daily allowance, and that's often not recommended for older adults because they're usually, those doses are too high. On the other side, you've got a product with some vitamins like vitamin C, zinc, and copper. Again, you have recommended daily allowances here, and then you've got some herbal products, and because these things aren't drugs, there's really no recommended daily amount. And so that's why these things are kind of left alone and empty. So what do we have to think about when we're talking about over-the-counter meds? So duration of self-treatment is usually very limited, and that'll be listed on the package of every product, how long a patient can use it without talking to their physicians about it. You're also really concerned with duplication of therapy because there are a lot of things that are over the counter that are also available prescription. And so there's potential for additive effects, adverse effects as a result, increased risk of side effects, and potentially, exacerbations of other medical conditions. And again, because there are a lot of combination products out there, the patient may be getting something they're not aware of. So that's why it's really important to read the label. Statistics show that about 25% of patients don't tell their physicians about their over-the-counter use at all. When they come into the office and you ask them what they're taking, they'll list all of their prescription meds, but not OTC. And you have to ask multiple times in different ways for them to actually tell you, oh yeah, actually I do buy this over-the-counter and I buy that over-the-counter. And then sometimes the med list grows significantly when you have all that information in front of you. But oftentimes patients don't tell, and providers often don't have the time to ask about over-the-counter stuff. So a lot of that stuff goes undetected. So what I'm going to do now is kind of go class by class and tell you what's available over the counter, what we should be careful with when it comes to managing older adults. So the first set of medications are over-the-counter first-generation antihistamines. So these are the drugs that are considered high risk in older patients because all of them have significant anticholinergic profile and can contribute to dizziness, falls, and cognitive impairment, in addition to sort of traditional anticholinergic side effects like constipation, dry mouth, urinary retention. So those side effects happen in all age groups, but in older adults, you're also really concerned about dizziness and fall risk, as well as cognitive impairment. And so you've got, 3 examples here. So diphenhydramine is probably the most common one, chlorpheniramine, which is often packaged in cough and cold preparations, and doxylamine. Diphenhydramine and doxylamine are sleep, very highly sedating. Chlorpheniramine is a little bit less sedating in terms of sleep efficacy. So a lot of things with diphenhydramine and doxylamine are going to be marketed as sleep aids. And so this is an example of a bunch of them, like ZQuil. And whenever you see extra words, extra numbers, extra letters on packaging, that usually means something. So it means additional ingredients. So for example, Advil, we know is ibuprofen, but Advil PM will contain diphenhydramine in it. This formulation happens to have 38 milligrams of it, which is a solid dose. Stuff like ZQuil will always have diphenhydramine in it in various doses. Things like Theraflu, nighttime, see right here, that'll have some kind of a sedating antihistamine. So the danger of all of these is that it has these ingredients in it, and it can make the patient more confused. They may present as demented, and also puts them at risk for falls and dizziness and all that other stuff. So not good options for older patients to take. The safer alternatives are the second generation antihistamines, and there are a bunch of them now over the counter. Things like Zyrtec, Xyzal, Allegra, Claritin are just a few examples. They're significantly less sedating. I think the most sedating of the bunch is probably Zyrtec. So I always recommend using it in the evening because it can make you a little tired. But in terms of anticholinergic potential, it's very low comparatively to the first generation drugs. And so they're really much safer to use. So there is a contraindication for severe renal insufficiency with creatinine clearance of less than 10, but they can be used fairly safely in patients with mild impairment. The nasal steroids are also an option. The amount of steroid in these formulations is very small. It's a fraction of what's available in the steroid inhalers, for example. And so usually they're pretty benign. Sometimes with prolonged use, you can get a little dry nose. Sometimes you'll have nosebleeds, but generally speaking, they're pretty well tolerated. And again, these are some examples of products out there. So something to point out, like this is Allegra D, for example. Again, remember I said every letter, every number, every word means something. Well, Allegra is just a straight antihistamine, but the D also stands for decongestant. So this will be a combination product of an antihistamine and decongestants. And in the next couple of slides, I'll show you the reasons why we really don't want older adults to use a lot of decongestants. So be careful again with the combinations. For sleep, a couple of, these are supplements, alternative medications that are generally safer than first generation antihistamines. The one I like particularly is melatonin. The trick with melatonin is figuring out the dose. A lot of patients say, well, I tried melatonin, it doesn't work. Well, how much did you try? Some people will only try, 1 to 3 milligrams, and sometimes that's insufficient. So if that's the case, they should try 6, they should try 9 milligrams, up to 10 is generally safe. Occasionally you can push it up to 15. But melatonin is really good at regulating the sleep wake cycle. So if they spend a lot of time during the day napping, and as a result having trouble falling asleep, sometimes getting melatonin on board regulates that and allows them to sleep better during the night and less during the day. Valerian root is very popular with certain populations of older adults. I try to stay away from it. Mechanistically, it's a relative of benzodiazepines. So in larger doses, it can have the same effect. It's not that it's as addicting as the benzo, but it can cause confusion, increased fall risk, and things like that. So I generally don't recommend it, but occasionally at low doses, it may be appropriate in some patients. It doesn't work quickly. It takes usually several weeks to take effect, and it really doesn't put you to sleep the way a typical sleep agent does. It kind of relaxes you enough so that you can fall asleep. You definitely don't want to use valerian root in combination with other benzodiazepines, because there's potential for kind of overdoing it, and larger doses when you stop them can lead to benzodiazepine withdrawal, for example. Really, the best way to deal with insomnia is with sleep hygiene. So not any medication. So when you see a patient for insomnia, I really recommend that you go through these simple questions that are listed on the slide to kind of review what they're doing day to day, get a good 24-hour recall of their sleep schedule, nap schedule, exercise schedule, eating schedule, how much alcohol they drank, how much caffeine they drink, whether or not they use cannabis, what other things they do, like watching TV, looking at their computer screens a lot, exercising later in the day. Usually when I talk to patients about sleep hygiene, I find that they're doing at least 1 or 2 things that can be done better or avoided. And if they follow those recommendations, their sleep can improve. But also looking at the bedroom, whether it's comfortable, whether the mattress is new and comfortable, whether the temperature is okay. So all of that it can be really impactful in terms of getting a good night's sleep. And sleep hygiene has really been shown to be much more effective long-term in older patients than any medication you can prescribe. So moving on to cough and cold preparations, this is cough medications. There are 2 different types of cough medicines over the counter. The first was dextromethorphan, and the second one is guaifenesin. Guaifenesin is a mucolytic, which breaks up the mucus and allows you to cough up whatever junk is in the lungs or in the bronchi. And the dextromethorphan is actually a cough suppressant. A lot of these products over the counter are combinations of guaifenesin and dextromethorphan. So plain Robitussin, for example, is just guaifenesin. Robitussin DM contains both. There's also a Mucinex brand. Mucinex tends to be a little bit higher dose of both of these ingredients. So Mucinex extra strength or 12-hour or whatever has significantly more guaifenesin than plain Robitussin, and Mucinex DM has significantly more dextromethorphan than Robitussin DM. Mucinex brand used to be over the counter many years ago, prescription many years ago. And so we used to use it quite effectively, and now it's available over the counter. In terms of side effects, at over-the-counter doses, you really don't see a lot. They're fairly well tolerated. So especially during COVID, when we're using a lot of medications for cough, this was one of the ones we used quite often in our clinic. On the Beers criteria, they list Nuedexta, which is a prescription product with dextromethorphan in it. It's dextromethorphan and quinidine, and that's a particular indication for the indication for this drug is pseudobulbar affect. It can be used for that indication. It does, at those doses, it can increase fall risk and increase dizziness, but in the formulation it's available for cough, it's relatively safe. Now let's talk a little bit about decongestants. So remember that picture I showed you before of Allegra D? Well, there's a line of products with Claritin D, Allegra D, Zyrtec D. All of the Ds stand for decongestants, and the two decongestants we have that are available without a prescription are pseudoephedrine and phenylephrine. Now, pseudoephedrine structurally is related to crystal meth. So that's going to be behind the counter. So you have to ask the pharmacist for it, and they'll document that you've purchased pseudoephedrine to make sure you don't buy enough to actually produce crystal meth in your home. Or you can buy phenylephrine just over the counter, either by itself or in combination with an antihistamine, for example. The reason we don't like using decongestants in older adults is because there's some pathomimetics. They're going to increase blood pressure. They can potentially cause hypertension in somebody who's normotensive, and certainly increase blood pressure in somebody who's already got hypertension. They can cause anxiety, they can cause jitteriness, they can cause palpitations, and they can cause insomnia. Some of these combination products are 24-hour products, so they do last all day, and will often have patients have trouble falling asleep when they're taking these meds. You've also got nasal sprays, which are maybe appropriate for some patients short term. All of these are also some pathomimetics, and so with long-term use, I think of more than 5 to 7 days, what ends up happening is you can get rebound congestion if you use them continuously. So you want to shorten the course to just a few days when you're the most congested and you need help breathing through your nose. So if you use it short term, it shouldn't have any side effects. And typically it doesn't have any systemic side effects when used intranasally. But long term, it can cause rebound. And I've seen cases severe enough that you actually have to give them a Medrol pack to reduce the congestion. These are some products, pictures of products that are available. And as you can see, they're all very colorful, and some of them have extra letters and designations. So like Mucinex D will have guaifenesin and pseudoephedrine in it. So because D always stands for decongestant. Mucinex DM is going to be guaifenesin and dextromethorphan. Here's plain Mucinex with quite a bit of guaifenesin in it, 600 milligrams, which is a significant dose. And then you've got Sudafed Sinus. So anytime you see sinus, it's going to have a decongestant in it. And then I think this is pseudoephedrine, which you have to buy behind the counter. And this thing that looks very similar, it's got phenylephrine, which you can buy over the counter. So these are all the little letters and what those letters usually mean. Let's go on to talk about heartburn and dyspepsia. So I've listed 3 different classes of things that are available over the counter. The safest and the quickest acting actually are antacids. They just neutralize this acid that's there already. They provide relief almost immediately, and they're generally pretty safe with the exception of a couple of formulations. So I really like Tums. Most of our older adults need some calcium anyway to supplement, and this calcium carbonate provides that. You know, a lot of the formulations are combinations of magnesium hydroxide and aluminum hydroxide. So your milk of magnesia, your Mylanta, will typically have equal amounts of magnesium hydroxide, which by itself causes diarrhea, with aluminum hydroxide, which by itself causes constipation. But when you combine the two, there's a neutral effect. So you get neither constipated nor do you have diarrhea. Some of these antacids will also have simethicone in it, which is usually used for gas. So it's an anti-gas medication. So this is you know, a decent formulation there. The thing you have to watch with calcium carbonate is if you know, obviously you don't want to overdo it, and calcium carbonate in large doses tends to cause a lot of bloating and kind of gas. So, you know, limit the dose to 500 or 600 milligrams at a time, and then the full dose will be absorbed and you'll get the calcium benefit from it as well as an antacid benefit. This Alka-Seltzer is not the best thing for older adults. This particular formulation has aspirin in it, which is unnecessary, and it can actually irritate the stomach, can cause bruising and bleeding, especially in combination with a baby aspirin or Plavix or something, or an anticoagulant. And it's also got sodium bicarb. Some Alka-Seltzer preparations have a lot of sodium in it, and they can actually cause, you know, CHF exacerbation, edema, certainly can increase blood pressure. So be careful when they tell you they've just purchased an antacid that tastes great and it's a little tablet you put in water and it fizzes and it's wonderful. So be careful with that. There are also H2RAs. There's only 2 that are available over the counter now. That's famotidine, which is the preferred agent, and cimetidine. Cimetidine is a very old H2RA that's typically associated with a lot of drug interactions. It inhibits the P450 pretty significantly and causes all kinds of other drugs levels to go up. But famotidine is the preferred agent. You do have to renally dose adjust H2RA. So you do have to keep an eye on the kidney function. They are preferred long-term acid blockers on the Beers criteria. You know, they don't want us to use PPIs long-term due to various long-term side effects of using PPIs. So famotidine is preferred, but you do have to keep an eye on the kidney function and dose reduce it if creatinine creeps up. Proton pump inhibitors are also available over the counter. So that's where there's potential for duplication, potential for adverse events if they're taking something OTC and then you're giving them something with a prescription. The Beers criteria lists PPIs as high-risk meds because long-term use greater than 8 weeks, it's associated with, you know, B12 absorption problems, calcium absorption problems, and fractures as a result. Magnesium deficiency, B12 deficiency, potential risk for C. diff infections. So you really don't want your patients to be on long-term PPIs if you can help it. There's also some potential for drug interactions with some of the PPIs with clopidogrel. Clopidogrel is a prodrug that gets converted to an active substance, and omeprazole and esomeprazole are enzyme inhibitors which prevent that conversion, so it may render clopidogrel ineffective. These are some of the pictures of products out there. A lot of them, again, are combinations, like Pepcid Complete, I think, has a bunch of calcium in it, in addition to the famotidine. Gaviscon is actually an interesting product. The original formulation of Gaviscon had alginic acid in it, which was really effective for GERD. Basically, you take it and the alginic acid bubbles up in the stomach and serves as a physical barrier for the stomach acid not to go up the esophagus. It's no longer available in the United States. You have to buy it in Canada, but it is very effective for GERD and much safer to use than long-term PPI, for example. So this is kind of an old story from 2010, but I just wanted to point out this is why it's really important to read the active ingredient list. So these products look essentially identical, right? Maalox Advanced, regular strength, maximum strength, and total relief maximum strength. What does all that mean? You assume they're all kind of the same. You assume that this is a little bit less strong than this, so this probably has more medication than this. But what is total relief? Well, when you look closely, so remember, I said Maalox usually is a combination of aluminum and magnesium hydroxide in equal amounts. And sure enough, like for regular strength, it's 200 and 200 of each. For maximum strength, it's 400 and 400 of each, and they both have, you know, a little simethicone and a little more simethicone here, 20 and 40 milligrams. But this total relief actually has bismuth salicylate. So, you know, if you have an aspirin allergy, for example, you could really get into trouble using Maalox if you have a true allergy where you have shortness of breath or rashes or whatever. If you're also on you know, an anticoagulant or another antiplatelet medication, there's a potential risk for bleeding. So, and you'll have no idea why you're bleeding because all you're taking is Maalox, and nobody bothered to look at the active ingredient to see that this actually it's a different formulation than these two. So again, look at the active ingredients carefully. Constipation. So constipation obviously is really common with older patients, and you really, first of all, want to figure out why. A lot of it is really easy to fix with just having more fluids during the day. A lot of patients will not drink enough and therefore will get constipated. And then constipation is probably one of the more common side effects drugs have. So things like iron, opioids, even diuretics can cause constipation. So you really want to screen the med list for that to see if you can eliminate some of these things and improve symptoms that way. But if you have to use a medication for constipation, here are your options over the counter. So you've got your bulk forming laxatives, which are probably the safest ones, provided you drink more water, a lot of water with it. I've actually seen a number of patients get into trouble with impaction because they take the Metamucil or the Citracel without sufficient water, and then they get super constipated and gassy, and it creates a bigger problem than they had originally. So you want to make sure that there's lots of water with this. And then you've got the osmotic laxatives. Generally, we want to avoid things like milk of magnesia chronically because it can lead to an electrolyte imbalance. Magnesium citrate, certainly, it sort of comes in a little very unassuming white bottle. If you drink the whole bottle, you should go straight to the toilet and sit there because the onset of effect is pretty quick and pretty strong. And in an older adult, that can certainly lead to dehydration if it's used chronically. Miralax is probably the safest option. It's sort of a gentler osmotic laxative. It usually takes a few days to kick in. It doesn't work overnight, but once it does, it produces soft, nice bowel movement on a regular basis. Then you've got your emollients like sodium, so docusate sodium, which kind of adds a little fat into the stool, and it generally just makes it softer. It doesn't propel anything out, and that's why you don't want to use it by itself for opioid-induced constipation, because all it does is just softens the stool. So if you've got an opioid in there and it blocks peristalsis, and you've got a stool softener, you've got this soft stool sitting there, unable to move out. And so you could actually potentially have fecal incontinence as a result because it eventually starts leaking out. So you don't want to use docusate alone if there's opioids on board. You can use docusate with a stimulant like a Senna or a bisacodyl, and that'll propel, restart peristalsis and allow the stool to come out. And if they're also on docusate, it'll also be soft. So stimulants typically work overnight. And so you can either do Senna or bisacodyl. There's really no difference in efficacy. Senna is natural, bisacodyl is synthetic. That's really the only difference. The biggest issue with stimulants is they can cause cramping, and if they're excessively used, they can cause an electrolyte imbalance. And mineral oil, potentially unsafe in older adults, and that's because of a potential aspiration risk. I think when this risk came out, they were probably used in a lot of frail elderly in nursing homes who weren't getting up much, but that sort of contraindication stuck around. These are some examples of products out there. So this is what magnesium citrate looks like. So very sort of benign looking, but it's quite potent. This, again, here's an example of a combo. So Senocot is Senna, so a stimulant laxative. But remember, every letter means something. So Senocot S actually also has docusate in it. So this is a combination of a stimulant and a stool softener together. Generally pretty safe. For diarrhea, we've got a couple of options. We've got bismuth salicylate and loperamide. So bismuth salicylate, on the one hand, it's got a salicylate in it. So if there's an allergy to aspirin, you definitely want to stay away. If they're also on blood thinners, there's potential risk for bleeding. And there's an increase, like warfarin, INRs can go up, things like that. It does turn your stool black when you use it, and it typically requires multiple administrations for the diarrhea to actually stop. The nice thing about bismuth salicylate is that it doesn't keep toxins in the gut any longer because it doesn't slow down peristalsis. So if there's an infectious cause for the diarrhea, it'll get rid of it faster, versus loperamide, which is basically a peripherally acting narcotic. When I was in school many, many years ago, decades ago, loperamide was a Schedule 5 drug. It was prescription and it was controlled. The way it works is it slows down peristalsis, and so it can potentially slow down the gut and leave whatever bacteria is causing the diarrhea a little bit longer. So really shouldn't be used as self-treatment in older adults. Here are some products that are out there. That's what they look like. Pain meds. So obviously there's Tylenol. The maximum for older adults is 3 grams per day, not 4. And the trick with Tylenol is it comes in different strengths. So there's regular strength, which is 325, extra strength, which is 500, arthritis strength, which is 650. So it's important to figure out which of these your patients are using and how much. Tylenol is also available in combination with other meds. So you want to keep track of the total daily dose, not just the actual not just the individual Tylenol administration. If somebody has liver disease, you want to stick to closer to 2 grams a day. And at larger doses above 2 grams, it can interfere with warfarin. Traditionally we want to avoid NSAIDs with warfarin because it increases the risk of bleeding, but larger doses of Tylenol long-term can increase warfarin effect. All NSAIDs are on the Beers criteria, so we really want to be careful using them. Not only do they cause an increase in blood pressure, but they can also cause edema and CHF exacerbation. They can certainly cause GI toxicity, and they can cause acute kidney injury. So you really want to be very selective and really be careful with using these NSAIDs in very, very specific patient populations. Obviously, there's an increased bleeding risk with steroids, with Coumadin, with antiplatelet medications, things like that. Voltaren gel is a much safer alternative. It's topical. It's 2 to 4 grams 4 times a day. Only 6% absorbed systemically. So relative to the PO NSAIDs, much, much safer. The trick is to give enough of a dose each time. All Voltaren packaging come with a ruler. For some reason, it's stuck to either the top or the bottom of the container. So you really have to go in there and pull it out and look at the ruler and measure out the dose every time. I think it can be very effective if an appropriate dose is used multiple times a day on a schedule. You've got other topicals like lidocaine 4% patch. So 5% is over the counter, 5% is prescription, 4% is over the counter. So very close in efficacy. So if 5% patch is not covered, you can go over the counter and buy it without a prescription. Lidocaine should be used 12 hours on, 12 hours off, and you can use up to 3 patches a day. You've also got things like capsaicin, which is a hot pepper derivative. So sometimes it can be really helpful because when you apply it, either in cream form, gel, or patch, it really burns the area and it kind of distracts from the original pain you had. So it's kind of a counter irritant that way. Older adults, though, tend to have thinner skin. So sometimes the hot pepper derivative is just too strong and it really burns the skin and causes a burn on them. So you be careful with that. But there's also methyl salicylate, which is a salicylate derivative, obviously, and trolamine, which is also a salicylate derivative, which can be used in a similar way. Again, not absorbed enough to cause, a bleed or bruising. So again, this is just, Tylenol is everywhere. So when you're figuring out how much Tylenol your patient gets, look at all the combination cough and cold products they take, Tylenol packaging, headache medicine, and also whatever you're giving them prescription, because some obviously some pain meds also have Tylenol in it. And then, so these are some of the pictures of where Tylenol can be hidden. So for Dayquil and NyQuil, when you have a cold, so NyQuil is the stuff that has high risk antihistamines in it. And Dayquil usually will have decongestants in it that can raise blood pressure and cause anxiety, but they also have a lot of Tylenol in it. So that's something to keep in mind. Excedrin, which is traditionally used for migraines, this particular formulation has 250 milligrams of Tylenol. There's some Excedrin formulations that's just Tylenol alone. So you think you're getting an aspirin and caffeine, but really you're just getting Tylenol. And this Alka-Seltzer for cough, mucus, and congestion also happens to have 250 milligrams of Tylenol. No idea why, just random. So look at the active ingredients. Some common vitamins and supplements. So this is, obviously older adults need their calcium. A typical older patient needs 1,000 to 1,200 milligrams daily. It's better to get it from food. So what I usually ask them to do is keep a food diary to figure out how much calcium they get from food, and then you supplement the rest. Large doses of calcium typically don't get absorbed well, so you don't want to give them anything over 600 milligrams of calcium at a time. But if they're getting nothing from diet, then they should probably be getting 500 or 600 milligrams twice a day. Vitamin C, people use it for all kinds of things, but it's never been shown effective for preventing a cold or helping with a flu. It can cause a false negative stool or cold blood within 42 to 72 hours after ingestion. It can also, large doses of vitamin C, it's ascorbic acid, it can irritate your stomach. And really, if you take too much, you just pee it out. So it's kind of a waste of a dose. Vitamin C, sometimes people use it for memory. Again, the evidence for it improving memories is slim to none, and it can increase the risk of bleeding at doses over 400 milligrams, 400 units a day. Omega-3 is usually used for high triglycerides and to reduce inflammation. Again, at higher doses, it can increase bleeding, and some omega-3 formulations can increase LDL while the lower the triglycerides. So that's something to keep in mind. Chondroitin and glucosamine, I know glucosamine is not on there. It's used for osteoarthritis, but there's really no evidence that it's consistently effective. So generally, we don't recommend it. Biotin is really great for health and for your hair and nail strength, but it can suppress TSH, and it can suppress troponins if you're having a heart attack. So I would not take extra biotin. You might have great nails and hair, but you might die of a heart attack as a result. So not a great idea. Ginger can be really helpful for mild nausea, and it appears to be generally safe, but it does increase the risk of bleeding. So if they're on anticoagulants, antiplatelets, you really want to monitor for that. And there are a lot of supplements that give you more energy, but how do they do that? It's with caffeine and caffeine-related products. So some of them will just have plain caffeine as an active ingredient. Some will have green tea extract. Some of them have things like bitter orange, which is also stimulating. So look for those ingredients when people say, oh, I take this and I have lots of energy. And you look at their blood pressure and it's 20 points higher than it was 2 weeks ago before they started the supplement. So that may be why. These are some of the products and how much calcium they contain. So again, looking at the active ingredients is really important to figure out how much you actually need and how much is available in every product. It's also a good idea to look at the serving size. So some pay attention to that, because some serving sizes actually say 2 tablets, some say 3 tablets. So make sure you're looking at it carefully and the dose is appropriate. Sodium containing supplements like this Alka-Seltzer, for example, has over 500 milligrams of sodium per tablet. And if they take this particular formulation as directed on the package, they could be getting as much as 6 grams of sodium a day. This Zegrid OTC product is a combination of omeprazole, a PPI, and sodium bicarbonate with 1,100 milligrams of sodium bicarbonate in each capsule. So again, hidden sodium, not a great idea. So, when you're looking for over-the-counter products, make sure the patients are carefully selecting what they should be getting and counsel them on what's safe and what's not. And please encourage them to bring in all of their products so you can look at them. Over-the-counter products are full of these brand name lines. Like there's a whole Robitussin line, there's a whole Advil line, there's a whole Sudafed line, and what I mean by line is there are different products within that brand name, and they all have different ingredients in them. And so again, looking at the active ingredients, part of the label is very important. And here's some references, and I think this is it.